Hello, welcome to Advance Rehabilitation Services. My name is Maria Duran, and I am a board-certified occupational therapist, certified lymphedema therapist, and certified cosmetic surgery therapist. Today, I will be talking to you and teaching you how to perform self-manual lymph drainage of your upper extremity. So to start with the manual lymph drainage of your upper extremity, I suggest that you have some items near you, or like I like to use castor oil. I like the properties of the castor oil as an anti-inflammatory oil, as well as it helps me have a better grip of the skin. I use this with my clients who don't have any allergies or any issues when I use this type of oil on their skin. Another item that you could possibly use if you don't like oils, you can also use a cream. The cream could be any brand that you like, as long as it's a moisturizing cream that is hypoallergenic, and it will keep your skin from having any irritations afterwards. So you have to be careful as to what you want to use. I like to use the equivalent of Eucerin cream for my clients who prefer to use cream instead of an oil. There are other products in the market. There's Cutimed by Jobst, and what I like about this item is that once you perform your manual lymph drainage in your arm, these will not interfere or is meant to be worn on the skin, and afterwards you can put your garment on, which is what you should be doing if you need to wear a garment due to the advanced stage of your lymphedema. So stages 2 and up require to have a compression garment at all times. And this item, the Cutimed, is supposed to help with the fibers, to protect the fibers of your garment after you perform your self-MLD, or for your daily use, and then application of your garment afterwards. Okay, so I'm going to start showing you how to perform self-manual lymph drainage of your upper extremity. Again, this is applicable to both extremities if both arms are affected, but I'm going to show you only on one, and you can follow through with your other upper extremity, okay? For starters, we're going to perform the opening of your lymph nodes that are available for the fluid to be canalized to. So we're going to start with the neck. Just above your clavicles, you're going to find a little bit of a hollowness, and then you're going to perform circles or semicircle. You're going to press on that, not super hard, like a medium, not super gentle either. And you're going to do it about 10 to 12 times. Next, you're going to do your arm. You're going to open up the lymph nodes in your arm. You're going to do 3 sections. I'm going to show you. We're going to do it at your arm area first. Three, 4, 5. Then your armpit area. You go in there, cupping your armpit. 1, 2, 3, 4, 5. As you can see, it's always coming towards your heart, okay? Always flowing towards your heart. And the third area is going to be just under your armpit. And again, semicircles or circles. 3, 4, 5. And that's what we're going to use to open up the lymph nodes that are available to us to canalize the fluid to. Next, I'm going to show you how to perform manual self-drainage of the arm. Prior to performing the manual lymph drainage of your arm, we have to do deep breathing techniques. So we're going to do that next. So you can lay down on the surface. Could be your bed, could be your couch. And you're gonna bend your knees. Be comfortable. You can put your hands on your belly. And you're gonna take deep breaths in through your nose. And you're gonna send all that air towards your belly, making your belly big. And then slowly you're gonna blow it out. I'm gonna do it again so you can take a good look at how my belly gets big when I inhale. And you always do it through your nose. Try not to do it through your mouth. Okay? And then you're gonna exhale through your mouth very slowly after, okay? Here we go. You're gonna repeat that sequence about 5 times. Okay, I never press on the belly. I just let my hands guide me as to how big my belly is getting and how the air is coming out of my mouth, so that my belly becomes nice and flat and smaller from what it was originally. Okay. Next, I'm gonna move on to showing you how to perform the manual lymph drainage of your arm. I'm gonna lift the sleeve on my t-shirt. And the first step I'm gonna do is I'm gonna clean up the side of my arm. So you're gonna put the palm of your hand onto your skin. Now, if your skin is very dry, you're gonna have difficulty moving your hand, your opposite hand, onto your skin. The purpose of the manual lymph drainage is to stretch the skin gently so that the fluid can be collected by the collectors in the lymphatic system and then dump out of the area that is being affected by the lymphedema. So if your skin is too dry, you're gonna need to use the items I had mentioned before. You can use your oils, your cream, anything that is gonna give you that nice grip onto your skin. So for me to show you, for the purposes of showing you this video, I'm gonna use a little bit of the castor oil. I don't use a lot of it. And then what I'll do is I'll just put it on my skin. And this is gonna help me have a nice grip. Okay, so like I mentioned before, we're gonna start by cleaning up the side of your arm. So think of your arm here having a line along, and then you're gonna cup your hand here, not too hard, not like this, gently, like if you were gonna just sit your hand on your arm. And gently, you're just gonna pull the skin up. And remember, it's the sequence always towards your heart. I'm gonna do it a couple of times. So you could do it 5 to 7 times approximately to start cleaning up the area. The reason why we're cleaning this area is because next we're gonna start dumping the fluid from the arm into this area to carry it out again, okay? It's like, so what you're gonna do is you're gonna put your arm out, or if it's too heavy to put it out like this by yourself, you can use pillows, you can use a table, you can help your arm support in some other way. Okay, I'm gonna keep it up in the air. And what you're gonna do is you're just gonna start pushing the fluid from the inside of your arm onto the area that we were previously cleaning. Okay. I'm going to do that a couple of times. Again, it's gentle stretching of the skin. Now we're going to do the back of your arm. And always to that area in which you're going to dump again. You're going to move all of that out of the area, okay? I'm going to do it a couple more times here in the back of my arm. And now I'm going to move all this fluid that I have accumulated here, I'm going to move it up, always towards the heart. And also towards the lymph nodes that you open, okay? You want to make sure that you carry this fluid out of the area. Again, gentle strokes. Just pulling your skin. A little bit of pressure, pull the skin. And you're going to repeat this 5 to 7 times. Good. The next thing you're going to do is you're going to open up the lymph nodes in your elbow so that we can drain your forearm, your hand, and your fingers, okay? In the front of your elbow, you're going to bend a little bit, and you're going to, again, cup that area and gently, semicircles. You can do circles as well. So you're pulling on the skin with a little bit of pressure in there. Not too soft, not too hard, just the right amount of pressure to open up the lymph nodes. About 5 to 7 times. Then you're going to do it in the back of your elbow as well. You can do it on the sides. Always with that cupping. You can use your fingers. You can use your entire hand. And it's that motion. Okay? Try not to keep your fingers too stiff if you use your fingers, because this is what it's going to look like. You're not really cupping the area. You need to cup it gently. You're also doing the side of your elbow. Okay, about 5 to 7 times. Next, you're going to do the top of your arm, your forearm, excuse me. So again, you're going to cup your opposite hand onto your forearm, and gently you're going to pull the skin up like so. And you're going to dump it in all these areas that you already opened up. We're going to do it about 5 to 7 times also. And as you can see how my skin stretches. Now we're going to do it with the front of your forearm. Same thing. How the skin stretches. I hope you're able to see it there. Okay, same thing, 5 to 7 times. Next thing you're gonna do is you're gonna stretch the skin in your hand. Smaller circles, the back of your hand. So you may be asking yourself, why is she doing it from the top to the bottom and not the opposite way? The reason is that you need to clean up everything on the top first to then send the stuff from the bottom up towards the heart, right? You want to clean the area before you dump more of the bad stuff out of the area. You don't want to dump bad stuff over bad stuff over bad stuff. You want to make sure that all of the bad stuff is out of the area first, and then you start moving away from your body, distally, away from your body, and cleaning all that so all of that can move out, okay? So I'm done with the back of my hand, again, 5 to 7 times. Then the front of your hand. You can use your thumb for this. If you like to. You may cover less of the area of your hand and you may have to do more strokes, or you can use all of your fingers and you're going to cover more of the area of your hand. Again, you're getting rid of all of that protein-rich fluid out of your hand. If your hand is the area that is problematic, for some people, it might be like a more swelling hand or more swelling elbow. You can stay a little bit longer, okay, taking care of those areas that are a little more difficult or more full. Okay, next, again, 5 to 7 times in front of your hand. You're going to start working your fingers. I'm going to start with my thumb, and you cup your fingers like this. You put it on top of your thumb, and you're going to start, again, proximally, okay? So you start with the bottom of your thumb, pushing down towards the area that you already cleaned. We're going to do a round, about 5 to 7 times, and then you're going to go to the top of your thumb, about 5 to 7 times. And then you go back down, because now you're clearing whatever you dump from here to here, you have to clean it out as well. And that's what's going to happen with every single one of your fingers as well. Now we're going to go to the index finger. In my case, you can start even on your pinkies. It doesn't, on your pinky finger, it doesn't matter where you start. I'm going to start in the proximal part of my finger. Then I'm going to go to the middle of my finger, pushing the fluid out. Then the top of my finger. I go back to the middle of my finger. Then I go back to the bottom of my finger. And you're going to move on to your next finger. Same thing, same sequence. For time purposes, I'm going to move a little bit faster. And you're going to do it 5 to 7 times in each part of your finger. You can do a little longer if your fingers are the problem area, like if they are more swollen, more congested. You stay as long as you feel comfortable. There is no wrong time for you to stay there. You can stay as long as you need to get rid of that fluid. Next, you're going to clean up again, because now you have dumped everything from your fingers onto your hand. So again, stretching the skin. I'm going to do it only 3 times, but you can do it 5 to 7 times. If you need to stay there a little bit longer, you stay there a little bit longer. That's 3. The front of your hand again. moving the fluid out of the area. You see, I'm stretching the skin. I'm not just doing this. I'm not brushing it, okay? A little bit of pressure to stretch the skin. And now I'm gonna move on to the areas that I already cleaned before, okay? So you can start in the back of your arm. Again, you're gonna cup your forearm, move the skin, stretch that skin. And moving all of that fluid that's coming out of your fingers, your thumb, your hand, and now your forearm, the top of your forearm. I'm gonna do it only 3 times, but you can do it 5 to 7 times. Same thing with the front of your forearm. And now you're gonna open up those centers again in your elbow, the front of your elbow, the back, middle, and outside of your elbow. You can cup them, making sure that the skin is stretching. And now you're gonna clean everything up. You're gonna bring it up your arm, okay? Again, I'm gonna cup it and just stretch the skin. And again, if your lotion or cream starts to get dry and you're losing that contact, the skin on skin contact, just put some more lotion, put some more cream. You need to do it in order for you to be able to stretch the skin. Otherwise, you're not gonna accomplish much. Five to 7 times. I'm gonna do it 3 for the purpose of showing. And then you go back into your arm area again. Now you're gonna dump that fluid. Do it a couple more times, making sure you cover all those areas to get rid of that protein-rich fluid, to decongest. And I'm gonna do it to the back of my arm. And now I'm gonna bring it up again, stretching the skin. Remember, towards your heart. Okay, now that you've performed your manual lymph drainage of your arm, if you have too much of the cream, lotion, if you feel sticky and you need to wear your garments, please feel free to clean it off. You can use a towel, you can go wash it with whatever is comfortable for you, and then you put your compression garments on. Okay, very important to keep with your garments, especially if you are at stages 2 and up of lymphedema. That's irreversible, and lymphedema problem stages. So you have to make sure that once you decongest the area, you keep it decongested with your compression garments, okay? And make sure to, after you take your garments off at nighttime, your daytime garments, you take them off before you go to bed. You can put more lotion on your skin, making sure, or cream on your skin, making sure your skin is always hydrated. You don't want any dryness on your skin, in your affected skin, or anywhere in your body, I should say, because what's going to happen is you're going to have the skin is going to crack, has a tendency to crack, especially now that the winter months are coming, and you're going to have possibly a higher risk for infection as the skin breaks, and you may have an open wound. Okay. All right, and that's all for the manual lymph drainage of your upper extremity. If you have any questions, please feel free to reach out to my office, or you can leave a comment in this video. I thank you for your attention, and I look forward to working with you on your path to better health.